name is Christopher Bendana. I'm going to be the instructor. Here's the BLS manual for the student. And then here's my BLS manual. And we're going to start off today with the BLS video.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity.
Alright. Because you're a nurse, we're going to be going into the in-facility provider.
On any given day, and at any time, you can encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. Both chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the in-hospital chain, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate. For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions.
Because most adult cardiac arrests occur at home or in other places that are outside of a hospital, we'll look at the chain of survival for an out-of-hospital cardiac arrest first. A son drives his father to a doctor's appointment. The father collapses, and his son realizes that he needs to find help. A nurse runs out of the doctor's office and tries to get a response from the father. She recognizes possible cardiac arrest and sends the son into the office to call for help and set the emergency response system in motion.
The chain of survival begins right here with the nurse's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must first recognize the signs of cardiac arrest, such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should immediately activate the emergency response system and begin high-quality CPR.
Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are two simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The nurse begins chest compressions without delay. The office assistant summons another nurse to help. The second nurse arrives with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight, portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
Once EMS providers arrive and take over, they provide advanced life support. This extends the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the person.
After the person achieves return of spontaneous circulation, or ROSC, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that need to be performed when you suspect someone is in cardiac arrest. First, assess the scene quickly to make sure it's safe for you and the victim. Then, simultaneously check for breathing and a pulse.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
Now, we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So, we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there is still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
Alright, so we're going to practice exactly some safety assessment and no compressions. So, we'll fix this mannequin right here. So let's just say you're in the hospital, right? Going to room 13, and you see, let's just say the EKG plugs are off the patient, and they're not attached to the patient. You took them off, so they're bothering, right? So you're going to 13 because the monitor shows either no rhythm at all or abnormal, so you want to check up on them, right? So you go to room 13, go from there. How do you check to make sure that it's safe and stuff? So how would your assessment be?
Sorry. I gotta check on them and make sure that he was okay.
Yeah, let's say you just, just how would you wake him up?
I'm sorry. I'm nervous. Just go, hey, are you okay?
So with these mannequins, you can actually go way harder. And actually, let me give you some gloves too, that way you feel a bit better. it's like scene safety. Actually, the hospital ones, we can even just go like anywhere really. Just check in for responsiveness. And let's just say they're like sleeping, right? Or they think they're sleeping. But we don't know, right? So check for responsiveness. Hey, you okay? You okay? Right? You're checking for responsiveness.
Okay.
You really want to try to wake them up because it's easier to take care of them if they're just sleeping.
Okay, yes.
So, hey, you okay? Are you okay? And then kind of take it from there.
Okay. Hey, you okay? Hey. Sorry.
Okay, now what would you do next?
Gotta check for breathing
Uh-huh.
and heartbeat
Yep, that's right. So you're checking it for our
Here.
pulse.
and
Yeah, so you're scanning the chest, right? And what are you scanning the chest for?
or rising or breathing.
Right? Yes, exactly. Rise and fall chest. For any breathing, you can see it up here, right? You could even actually, so like in the video, right, it showed you checking for a pulse, right, and you're scanning the chest, right? So there's one way you can also listen to the mouth, looking for chest rise and falls, you check for a pulse. And how long do you do this check for? How long do you check a pulse
At
for?
least 5 seconds, but less than 10 seconds.
That's perfect, exactly. And then, so that's a pulse. What about breathing?
It's together.
You can do it together, definitely. But if you do it separately, how long would it check in for breathing?
I don't know.
It's
I'm
fine.
sorry.
It's 5 to 10 seconds. Basically, anytime we
Same
stop
thing?
CPR, yeah, we're going to be stopping for 10 seconds. No more than 10
Okay.
seconds,
Yes.
right? So, let's just start from the start.
Okay.
So, is the scene safe? Yes, scene is safe. Okay, check in for responsiveness.
Hey, hello, are you okay? Hello? Okay, no.
All right.
And check breathing, and check chest.
All right. For how
And
long?
breathe. At least 5 seconds, less than 10.
Okay.
Both.
All right.
Yes.
So no pulse and no breathing. What are you gonna do now?
Then I have to put my hand on my chest. Then
So before
start.
that, what do you want? What do you want to come and help you? Right?
Oh
so-
yeah, I need to ask for help. 'Cause
Yes.
Otherwise, people can't
Yep.
give me the thing. Yeah, I am. Thank you. Right. So
So how are you gonna ask for help?
at the hospital, just
Yeah, at the hospital. What else is? Yeah, at the hospital. Any scenario, like
just
push a button, right?
yes.
Push a button. Okay. But let's say that button wasn't there. You would
Okay.
actually. Well, how would you do? Hey, you. Like,
Yeah, I'll yell
Hey, I need
to
some
the
help.
next person who
Exactly.
is
Right. All right.
close to me. Hey, I need
And
help.
what do you need?
I need the I need help with the
An AED.
A
That's
A-
fine. Yeah, it could be AED, right?
Yes. Well, yes. I need that, and I need to get 911 if it's in a different situation.
Exactly. Yeah. Call 911. Go grab an AED. Right.
Yeah.
All right. So let's just kind of just all over again, right?
Right.
So let's just imagine we're at Walmart, right? No hospital base. We're just at Walmart on 14. So before you're there, let's just back away a little bit. Picture. So aisle 14, someone's face down, right? They don't look good. What's your first step?
Let me check if it's safer on those.
Exactly. Scene is safe, right?
Yeah.
Now let's say you roll them over, nice facing, upright.
Yeah. I check for responsiveness.
So how do you
Hey. Hey, are you okay? Wake up.
All right, no response.
No response. Then I go check for heartbeat, check chest rising or not, and for breathing, and nothing. Then I
So no pulse, no breathing. Now what are you doing?
Then I ask for help,
Uh-huh.
and yep. Hey, get me the AED or give me help or call 911.
Okay,
Yeah.
I'm calling 911. I'll also go grab an AED.
Okay, and
All right.
then I do the thing.
Yeah. Yeah, we're gonna have you do 2 sets of 30 compressions.
Okay.
Okay, so, go ahead when you're ready, and I'm just gonna hit 2 green lights when you're ready. Go ahead. That's good. Okay. And then, when you're doing compressions, you just wanna make sure you're counting out loud. So how many are you at?
25, 27, 28, 29, 30.
Alright, done. And then just wait for, let's just say 10 seconds for the breathing process, and then we can go back. Alright, ready?
Back
Uh-huh.
and 1, 2, 3.
So we're pressing down, we're looking like 2 inches, at least 2 inches, 5 centimeters depth, right? Full coil, 4 truss, recoil. Alright, so now we're going to test you again, but when it hits 0, we're going to hit between 15 seconds to 18 seconds of 30 compressions, okay?
Okay.
So get ready. Get set. Go. Awesome. 17 seconds. Couldn't ask for a better time. That's terrific. Cool. So now we're going to push play. We're going to follow along with the video. Now that you got some practice in. So when you go over the scenario again, you're going to do the whole scene safety. You're going to do the assessment, and then you do some compressions. But we're just playing with the video, okay?
Okay, let's begin. In 3, 2, 1.
Hey, are you okay?
Hey, you okay?
Are you okay? Help, someone help.
Sorry, I'm trying to pay attention to what he's doing.
Looking for a pulse, right?
Activate the emergency response and get an AED.
Call 911. There you go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
That's okay. All right. Perfect. I think that'd be one more set. And then just make sure you count out loud too. All right, good job. Now we'll go back to the video.
Okay.
So let me set you up for success. There you are. You already have your and then we'll just go over our pocket masks quick.
So now, let's go through the use of pocket masks, and then we'll practice one rescuer skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescuer activity in our training today.
When the nurse finishes a cycle of compressions, she quickly places the mask with the one-way valve on the patient's face. She delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to 10 seconds or less.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using a head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face, and give 2 breaths while watching for slight chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each breath.
In this practice session, be sure to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest to rise as you deliver each breath over 1 second. We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve. We'll practice 5 sets of 2 breaths along with the video.
Alright, so we're just gonna practice ourselves and then we'll follow along.
Okay.
So, but basically, right, hand towards me, bridge of the nose, I'll just put that here. Well, you're supposed to make a C, this here. Now, so I'm on one-way valve, you guys are on one-way valve, right?
Yes.
So you're opening the airway, and then we're just gonna get one. Did you see anything? Alright. So the lungs are a little sticky, but we're gonna open them up. Okay, let me try again. There you go. Just gonna try that technique. So you can actually just put your thumb here, right? And then it helps you kind of lift up as you're securing the seal. So yeah, just, let me see. Let me see, doing this. And then you're pressing down as you're holding up. See, there you go. Try that. There you go, there's one. Let's do it again. Good. That's really good. Alright, so let me just push play. We'll follow along. And then let me see. There it is. Okay. Here we go.
Get ready. Begin in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths.
There's one. That's good. 2. Yeah.
Give 2 breaths.
There you go.
Give 2 breaths.
1 second. 2. Alright. Good job. We're good.
I was just looking to see if it placed right. Sorry.
No, you're good.
Okay, cool.
Now let's practice compressions and breaths together by using your pocket mask with a one-way valve. When switching between giving compressions and giving breaths, limit the time between compression cycles and breaths to 10 seconds or less. Make sure the chest rises with each breath, but provide ventilation just to the point of
so we're just gonna practice while watching. Here we go.
Here we go. In 3, 2, 1.
Hey, are you okay? Are you okay?
Okay?
Help, someone help.
Help?
That's right.
Here.
Activate the emergency response and get an AED.
That's help for again.
All right.
1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5.
Going very fast, dude.
8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12,
Didn't do it
13,
right.
14.
So we'll continue with the compressions and then we'll work on the
What is it?
So let me see if I can help. Alright, try now, because when you do compression, sometimes the lung sticks. There's one. Almost.
Do it again.
Okay. There you go. 1, 2. Okay. So again, we're gonna do. We're gonna work on the AED and a bag mask now. We're gonna be playing a video.
And also saying, where people and resources are already accessible, the real challenge becomes logistics. In other words, the coordination of rescuers and resources when more people are involved. However, your first few steps are the same.
First, assess the scene quickly to make sure it is safe for you and the patient, and try to get a response. Then, simultaneously check for breathing and a pulse. If there is no response, no breathing, and no pulse, activate the emergency response system and make sure an AED is on the way. Then, immediately begin CPR, starting with compressions.
When additional rescuers arrive, they are able to assist in the remaining actions, including beginning ventilation with a bag mask device and setting up the AED. There are additional actions that can be taken to increase effectiveness, such as removing the headboard so that it won't be an obstacle during ventilation, and bringing a step stool for the rescuer performing compressions.
The CPR backboard should be put in place as soon as possible. Position the CPR board under the patient while trying to minimize interruptions in chest compressions. As a note, make sure that you know how the beds in your hospital operate. This knowledge could save valuable seconds.
Attach the pads to the patient while the defibrillator is set on AED mode. It's important to be familiar with your AED or defibrillator and to follow your device's prompts for next steps.
The rescuer operating the defibrillator is responsible for clearing the patient for rhythm analysis and before shock delivery. If a shock is advised, clear everyone from touching the patient and deliver the shock. If time allows, compressors can take advantage of the time when the device is charging to deliver a few more crucial compressions. As soon as the shock is delivered, resume compressions immediately with a feedback device that provides real-time corrective feedback on CPR quality of rate, depth, and chest recoil. After each set of 30 compressions, deliver 2 breaths with the back mask device, ensuring that the chest rises with each breath. Continue these steps until the code team arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED, open the carrying case or the top of the unit, and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rate. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the heart's rhythm, followed by a prompt to clear the victim. Strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command and follow it. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will repeatedly analyze the shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If the victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
Providing effective ventilation is critical to successful high-quality CPR, especially in respiratory-related emergencies such as drowning, anaphylaxis, and
So we're just gonna go over the AD part real quick. So here's the AD. Alright, actually, so we're just hands you an AD. What's the first thing you do? Yeah, open it, right? So it's open right here.
And then I
Turn it on, right?
Okay.
Go for it. So you for the little
Adult patient.
AD.
If the patient is a child, press the child button.
So later on, we will have to hit the
Remove
children
the
button,
loading from the
but for
patient.
now it's an adult, we don't have to hit anything, right?
Remove packet and apply pad
So
on the
here's the
patient's bare
pads,
skin.
you put that, below,
Apply pad.
on the
and
left side
show
right
in
there,
the
and
picture.
start hitting the top right, chest.
Okay.
Remove packet and apply pad on
I'll
the
just put
patient's
it on,
bare skin.
analyze rhythm,
Apply pad as shown in the
shock is
picture.
advised, after shock is advised, we're gonna make sure.
And apply pad
Actually,
on the
during
patient's
analyzing
bare
rhythm,
skin.
it says analyzing rhythm, do not touch patient.
Apply
We
pad
wanna make
as
sure
shown
that
in
no,
the
everyone's
picture.
good. We wanna make sure.
Remove packet and apply pad.
Exactly, no
on
one's touching the
patient's
patient,
bare
right?
skin.
Then it's gonna say,
Apply pad as shown in the picture.
shock is advised. What are you gonna do?
Remove packet and apply pad on the patient's bare skin.
Exactly, no one's touching, right? And
Apply
before you
pad
press
as
it,
shown
just say,
in the
I'm
picture.
clear, you're clear, we're all clear. Just make sure, like, some type of
Remove
format where
packet and apply
I'm
pad
not
on the
touching, you're not
patient's
touching, no
bare
one's
skin.
touching. I'm back, stand back, we're all
Apply pad
clear, you're
as
clear.
shown in the picture.
So what it is flashing, I'm clear, you're clear.
Remove
No
packet
touching,
and apply
and
pad on
shot.
the patient's bare skin.
We'll play with this a little bit later.
Okay.
Now we're gonna focus on the BPM, so let me get your BPM out. Cool. There's your BPM. Where's your pocket mask? It's right there. I'm gonna have you take out your one-way valve. And then just a simple twist and turn. Yes. Now. Alright. When you're actually squeezing the bag, you actually just use one finger and thumb.
Okay.
Practice is perfect. Here it is. Alright. So where are you going now?
Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with a bag mask device is to use the two-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the one rescuer bag mask technique, so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence. We'll pause here to get into position.
Alright. We'll be practicing while watching the video, but we're gonna practice on our own before we do the video. Okay, so, just like a pocket mask, right, remove the bridge for the plain part, and the other part goes in the mouth. So this, now for this mannequin, since they are, light, what I do is I do use my, knee to secure the airway, and then I can breathe down. Alright, so for this, yeah, go for it. First one, grip. Yeah. So, what's happening is that, yeah, open airway, yeah. Almost, it's almost there.
Alright.
Oh, you can, for this part, yeah, go ahead and use all the fingers. You're still trying to, go on.
I'm sorry.
You're fine. So here goes the steam group, right? Almost. See that? See, there's just one finger now. But because of bags. There you go. So you may have to use the full grip just to open it. There you go. Talk to the back, yeah, go for it. Almost.
I think my hand's not doing the right way. I'm sorry. Hold on. Here. I understand why it's better with 2 people.
So go ahead and just try the 2 circle technique, and then I'll do the back for you. Ready?
Nope. I am.
Alright, ready? We got 1. Alright, that's good. Now let's try one hand off.
Do I not have enough strength in this hand to do it this way? Can you turn it the other side?
refresh. And see if you can try that again.
Here.
Okay, good. Keep trying.
Okay, hold on.
There you go. Yep.
My area is quicker. Dip right a little bit,
That's good. Yeah,
yay.
keep it up. Alright, so shake it off again. Let's try again.
I know, should throw the man out of his head.
There you go. Yes, there. Keep it up. There it is. It's good. Now, try one finger. There you go. See? Look at that.
So the problem is, this hand hold it, I see.
Well, it's good. I mean, we figured that out, right?
Yeah?
Alright. So now we're going to practice while watching, okay?
Okay, that's the thing.
Here we go.
Now that we're ready.
I'm going to turn a little bit louder because it's raining.
Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths.
There it is. Oh, and then just look out. That's solid.
Give 2 breaths.
It's raining, it's very little, but it is.
Give 2 breaths.
Yes, yes, yes.
There it is. Yep. There it is.
And give 2 breaths.
There it is. 1, 2. Very nice. Alright. So, when we're done with CPR, right? Doing our compressions, you should be able to get to the head pretty fast, because then you only have 10 seconds to get breaths.
Right.
So if you miss that time, you gotta resume CPR. Okay? Alright, so now we're gonna do 2 respiratory BLS. So that means someone's job will be doing the airway, and then I'll be doing chest compressions, right? The airway can also get in the AD set up,
Okay.
but we're gonna watch this video now. Alright, we can ask
Sometimes a cardiac arrest takes place close to where emergency medical services might be. And even then, immediate CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the 2-person or team rescue is a more common occurrence. So let's first look at the roles for 2-person rescues. The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a 1-rescuer scenario. And the second rescuer is responsible for powering up the AED and attaching the pads when a device becomes available, as well as for providing ventilation.
The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued, or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In 2-rescuer CPR, each rescuer has a specific role. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. Rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage Rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice 2 Rescuer BLS. Follow the video as you practice. We'll work on the full sequence, from the point of finding the victim until advanced medical help arrives. We'll pause here for you to get into position for the 2 Rescuer practice.
We're going to practice while watching 2 Rescuer BLS now. Go.
Okay, let's begin. In 3, 2, 1.
Alright, so again, we're going to switch. So, that way you can do both, right? So I'll do the chest compressions first. Once I do, actually, we're just gonna watch. No, we're not watching. We're gonna practice a little bit. I'll do chest compressions. You do the airway. Okay.
Hey, are you
Hey,
okay?
you okay?
Okay. Activate the emergency
Go
response.
call 911. Go grab an AED. Wanna check for a pulse, right? How long am I doing this
There's
for?
no breathing, no pulse.
5 seconds.
1, 2, 3, 4,
No
5,
pulse, no
6,
breathing.
7,
CPR.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Alright, get ready?
1, 2, 3, 4, 5, 6, 7, 8,
Alright.
9, 10, 11, 12, 13,
So that's more than 10 seconds.
16, 17, 18,
So, I'm doing compressions. Go ahead and get that bag. Oh no, on the patient.
Oh, here.
So that you're ready. Exactly. Yeah.
Yes.
Let up. Go ahead.
15, 16, 17, 18, 19, 20, 21, 22,
More.
23,
Give us some time. One breath.
6, 27.
There you go. Good job. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Go ahead. There you go. One breath. Yep. Okay. So just make sure one breath over 6 seconds. So we're done compression. But going with it. So go ahead. One breath. 1 second. Okay. Now. Yeah. Right. 1, 2, 3. 1. Okay. 1, 2, 3. Good job. 1. 2. No thing. 3. Good job. Alright. So yeah, good example. So someone's done compressions, right? See how difficult it is to get the good airway? You just start it now. Once you have a good seal, you don't have to like figure it out. You already have a good seal. You can just give those breaths. So that's being way more efficient. And that's what it's like working with a team.
Way easy.
Yeah, right. That definitely helped. Now this is my favorite part of this whole course. Special considerations.
Because most cardiac arrests happen at home or in a public place and not at work, you may not have access to a barrier device during CPR. This means that you may need to give mouth-to-mouth breaths without a pocket mask or bag mask device. Although we won't practice this, it may be a skill you'll need to use one day. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen.
Let's go through the steps to deliver mouth-to-mouth breaths. Start by holding the person's airway open with tilt, chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the person's mouth, creating an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person after 2 attempts, check for an airway obstruction, but then promptly return to chest compressions. Make sure you give each a breath over 1 second and deliver air just until you make the person's chest rise.
Today, we've looked mostly at the procedures you should perform when someone does not have a pulse. But you should also know what to do if someone has a pulse but is not breathing effectively. When that happens, rescuers should give breaths without chest compressions. This is known as rescue breathing. For adults, give 1 rescue breath every 6 seconds. Also, give each breath over 1 second and make sure that each breath results in visible chest rise. During rescue breathing, you should also check the person's pulse about every 2 minutes.
Awesome. So this is so practicing while watching for rescue breathing. Again, it's just like breathing, right? But instead of doing compressions, you just be giving them air. So
Okay.
it's 1 breath every 6 seconds,
Okay.
and it feels like a long time. It does. So I'll leave my. Actually, I'll just keep it on. I'll tell you. But go ahead and let's use the DBM. Let's set them up to give them a breath. And then you're gonna give them 1 breath. Sorry, you're gonna be giving them continuous breaths, but at 6 seconds intervals. So as soon as we get good airway. So as soon as you get a good chest rhythm fall, then we'll start it. So go ahead.
Still learning this. Oh, that doesn't help.
Yeah, it is. So, there you go. That's fine. Almost. Almost.
Yep.
There you go. Alright. So 1 more. Alright, so 6 seconds. Stay in. Alright.
Oh no.
Okay, one more? One more. Alright, that's 1. Alright, so now. Okay, go ahead. Saw that? Good. No, so it's 1 breath every 6 seconds. Right?
Just 1?
It's 1. Yep. You ready? Alright, go ahead and go. There you go. So I'll tell you when. Okay. Alright, do it again, hold on. Go ahead. Okay. Again. Isn't that wild? 1 breath every 6 seconds.
It works, it works.
Yeah. It's good. Good job. Alright, so we're gonna practice while watching. There you go.
Get ready. Begin in 3, 2, 1. Give 1 breath.
I see it.
Give 1 breath.
Awesome. Good job.
Give 1 breath.
But it did.
Give one breath.
There you go.
Give one breath.
Good job.
Give one breath. Give one breath. Give one breath. Give one breath.
We're done. So again, someone who does have a pulse, but they're not breathing or breathing efficiently, they're gonna need muscular breathing. This is one breath every 6 seconds. All right, this is a video on how to get breaths with an advanced airway.
Another way to deliver breaths is with an advanced airway. Devices such as laryngeal mask airways, supraglottic airway devices, and endotracheal tubes are types of advanced airways that are more secure for providing breaths. These devices help prevent gastric inflation and airway obstruction. Placing these devices requires special training that we won't cover in this course, but you should know how to give breaths when an advanced airway is in place. When you provide CPR to someone with an advanced airway, the ratio of compressions to breaths changes. Instead of providing 30 compressions in 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute, while another rescuer gives rescue breaths. In other words, when an advanced airway is in place, you won't pause compressions to give breaths. This goes for victims of all ages, and not pausing compressions allows blood flow to the heart and brain to remain high.
An opioid-associated life-threatening emergency is one condition that might weaken or stop a person's breathing while they still have a pulse. Opioids are medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in an adult who is unresponsive and isn't breathing normally but has a pulse, you should give one rescue breath every 6 seconds. Then, if your local protocol allows, give naloxone, but do not delay breaths to give naloxone. If the person does not have a pulse, you may give naloxone after starting CPR, but do not delay compressions. For further information on opioid-associated life-threatening emergencies, please consult your provider manual.
Treating cardiac arrest in someone who's pregnant can come with heightened anxiety because 2 lives are at stake. In addition, some rescuers may be unfamiliar with handling the visible anatomy of a pregnant woman. The best outcome for both the mother and the baby depends on BLS rescuers summoning help, providing high-quality CPR, and using an AED without delay. Compressions, ventilation, and AED use are mostly unchanged. If the abdomen is visibly rounded and additional help is available, rescuers should manually displace the rounded abdomen to the mother's left side during compressions to help with blood flow to the heart. More information is available in your provider manual.
Alright, so we're going to do your adult CPR and AED skills testing checklist. Okay. So I'm going to give you the scenario. Alright, here's our tools. Because it's just you and me, you're going to tell me, hey, you go grab an AED and call 911, I will. But if you're doing anything else, when I do give you the AED, I'm gonna do compressions for you,
Okay.
and then you take care of the AED and move it that way.
Okay.
All right. Sorry. All right. So, just make sure that you're set up for success. You are. Okay. So for the hospital scenario, you are working in a hospital or clinic, and you see a person who is suddenly collapsed in the hallway. you check the scene is safe, and you approach your patient. Demonstrate what you do next. So, you've already said the scene is safe,
Alright.
what do you do next?
Hey, are you okay? Are you okay?
Alright, you check for responsiveness, what else? What's next?
Then I'm gonna check for pulse
Okay.
and breathing.
Okay.
5 seconds to 10 seconds. And then I'll tell you to go get the AED and
Okay.
I don't know.
Alright,
whatever,
I'm-
no hospital, something like that.
I'm gone, I left, I'm gonna go grab an AED.
Okay, and then I start the.
So yeah, no pulse, not breathing.
Alright, so.
Pressing at least 2 inches, 5 centimeters, that's good, just a little 2 green lights.
30.
Alright, so you do, what are you gonna do next?
Back thing here.
You can go in, resume compression. Awesome, 16 seconds, you did 30 compressions. Let's get that airway. Okay, it's almost there, one more good one, there it is. Okay, good job, you're gonna resume compressions. Good job with the 2 green lights. Okay, go on and do your airway, because you're done. Also brought you the AED when you're done with the AED. My bad. Yeah, good job, I thought that. Alright, here we go.
Give the patient to the child. Press the child button. Remove clothing from the patient.
6 or 7.
Remove apply pad on the patient's bare skin. Apply pad as shown in the picture. Press pad firmly on skin.
Good work, awesome.
Apply pad
Resume compression. Make sure that the pads are secure.
Do not touch the patient.
Do not touch.
Analyzing heart rhythm.
Okay.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient.
Oh, no, don't touch.
Don't
Okay,
touch.
okay. Good call, thank you. Wait, am I clear? Are you clear?
I'm clear.
We're all clear,
All
right?
clear.
Alright.
Now we can do it.
Alright, what are we gonna do resuming?
Shock deliver. Begin CPR.
And we're done. Shock brought him back.
Yay, it's alive.
Good job. Okay. So that's adult. How do you feel with adult?
Yeah, it works.
Alright, so it does work. Good thing is, children's is very similar to adults, so
Good.
we're using the same mannequin, same ED pad. Pad, and we're gonna watch some videos again.
What you are about to see will include a portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured, those skills are not part of this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key elements of effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rides and avoiding excessive ventilation.
The team member operating the AED, or the monitor defibrillator, can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions in chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering monitor defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired during these compressions. You need some help after this?
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
And now you're too fast. Target heart rate is 110.
The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
Can you give me a recap, Nick?
Yes, we've been doing CPR for about 4.5 minutes. We've got 1 shock, 2 no shocks, and you've given 1 dose of FEID.
Okay, so anybody have any ideas on what else we can try with this patient?
The last category is how to communicate. Closed-loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
So Scott, why don't you give 1 milligram of epinephrine? 1 milligram of epinephrine ID.
In addition to using closed-loop communication, teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members.
145.
Okay, let's go ahead and charge up.
Charging.
We have good pulses with CPR?
Good federal pulses with CPR still.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.
A high-performing team achieves specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials, or ROC trials, showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, you may notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle. When using an AED, the prompts will instruct you when to pause. For example, during rhythm analysis or shock delivery.
Switch compressors with the second compressor coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
3, 2, 1, switch.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course.
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both the what and the how flawlessly. That requires practice, and effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type of program, talk to your instructor.
All right.
Now that we've covered adult BLS, let's discuss BLS for children. It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid overdose, or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
Alright, so we're gonna do a 2-person rescue. So you can do, so what's the difference again?
So instead of going 30 compressions, is 15 instead.
Exactly, yeah. So, what would you like to do? Compression? We're gonna switch. What would you like to
I'm gonna start with the air.
The air? Okay.
Yeah.
Alright, so alright, so we'll do 15 compressions, right? Okay, ready? Alright, here we go. Good. Wet, 1 breath. Alright, here we go. There you go. Okay, here we go. Awesome. Now we're gonna switch. do compressions first,
Okay.
then you do your, okay.
So, let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, all the
So we're just together, right?
Let's go in 3, 2, 1.
Alright, is this in safe?
Yep.
Yeah,
Hey,
okay.
are you okay?
Alright, go ahead.
Are you okay?
Hey, are you okay? You okay?
And give me ED.
Go
Go
grab an
get,
AED,
yep,
okay?
go get the AED.
Alright, check for pulse, all you.
There's no breathing, no pulse.
No.
1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7,
Up. Then we're gonna keep practicing spin around. So I'm gonna do 15, and then you take over. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. There you go. Good job. So now we're gonna move on to infant VLS.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we use for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device. Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services. Or, if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, check for a brachial pulse immediately. If you do not detect a pulse, perform 2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds, which is about 20 to 30 breaths per minute. To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, press your index and middle fingers gently against the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the breastbone. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to depress the breastbone.
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at least 100 to 120 compressions per minute. After each compression, allow the chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So, let's get into position to practice compressions.
All right. So there's our infant. Same thing, 2 green lights is going to indicate good compressions. Yellow is too fast, red is too slow. And lower here. Right. Take action. We're going to play while watching. I'm just going to do 30 compressions.
Let's go in 3, 2, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Maybe one more.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And we're done with that.
Now, let's look at the technique for delivering infant breaths with a bag mask device. This is similar to the adult bag mask technique we practiced earlier. 2 things to note before you start. 1, make sure you have the right size mask, so that it isn't too big or too small. And 2, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breaths.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. But be aware that if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just enough breath over 1 second to make the chest rise. If the chest does not rise, then you're not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
Now, let's practice 5 sets of 2 breaths. Deliver each breath over 1 second, deliver just enough breath to make the chest rise, and make sure you have a tight enough seal with the mask on the infant's face. We'll pause here while everyone gets into position.
So this one, what we are trying to do is get a neutral position. If you extend it too much, you do close the airway. You got an open airway. So it's kind of tricky. Okay. So I'm gonna have you try it. You want to make sure you get a good seal on it.
This way?
Yes.
Uh-oh, no, this way.
There you go, that's better. Almost. Okay.
Spray gun. It's making a noise. There you go.
You're not too far back. There you go, like that.
Right,
Like
not too
that.
much though. There you go.
It's good. Alright, so, while practice while watching, keep it there, cause you gotta get the seal on it.
Follow along with the video. Here we go in 3, 2, 1.
So we're putting it on right now.
Give 2 breaths.
Okay, we get the breaths.
Give 2 breaths. Give 2 breaths. Give 2 breaths.
It's good. Good job.
And give 2 breaths.
Good job. Let's just shake it up a little bit and let's try it again. Let's do a couple more breaths. It's good. It's also good. Good job. So we're gonna do a 2 breaths for infant. So we're gonna switch off, of course. So, when we do this, it's pretty similar to the adult skill test, but instead of getting an AD, we're going to be getting a BDM. So, instead of, hey, you go call 911, go grab an AD, hey, you go call 911 and give me a BDM.
BBM.
Yeah, bag valve mask. Yeah, that's what that is. Yeah. And then, so we're doing 2 sets of CPR. And because there's 2 of us, what's the compression ratio going
So 15-2.
to be? 15 and 2. That's right. So, we're gonna follow. Actually, yeah, we're gonna follow along with this video. But I'll probably do. I'm gonna bring you the BBM, and then I'll take over compressions once I give you the BBM, and once you're done with your compressions. So when we switch the airway, I'll give you the airway.
Okay.
Now it's time to practice 2 rescuer infant CPR. But before we begin, let's note a couple of differences between 1 rescuer and 2 rescuer infant CPR. One difference is the hand and finger placement for giving compressions. In 2 rescuer CPR, the person doing compressions should always use the 2 thumb encircling hands technique.
The other key difference between 1 rescuer and 2 rescuer infant CPR is the compression to ventilation ratio. As mentioned before, instead of a 30-to-2 ratio in a 1 rescuer situation, 2 rescuers should use a ratio of 15 compressions to 2 breaths. So let's practice compressions for 2 rescuer CPR. As a reminder,
Are we ready?
make sure your rate is between 100 to 120 compressions per minute. Use a 15-to-2 compression to ventilation ratio because you have 2 rescuers. Make the compressions approximately
Same
1.5
as adult,
inches
100,
or 4 centimeters deep. Allow the chest to fully recoil after each compression and count out loud for your partner.
Time to practice 2 rescuer infant CPR, starting with scene assessment. We will pause here while you get into position with the mannequins.
So when you're ready, remember the scene thing, you gotta tap the foot, right? Hey, you okay, right?
Right. BBM.
I'll take it.
Okay. Here we go, in 3, 2, 1.
Hey, you okay?
Hey, are you okay? Are you okay?
You gonna check for fake roll pulls? For how long? Yeah, perfect.
Activate the emergency response and get an
Go
AED.
call 911.
There's no breathing and no pulse. 1,
It's
Okay.
the BBM, all that.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Number? Two breath.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
One breath. Two breath. Yeah. Cool.
You're done.
Alright, so. Here's BBM. So start from the start. Need safety. Is it safe? Yes, it is. Okay. Jump shot. Hey, you okay? Are you okay? No response. Hey, you. Go crowd. The BVM and call 911, please. Checking the brake roll. Listening.
Sound.
No pulse. No breathing. Initiate CPR. So here we go. Oh, we're doing 2-person rescue. Okay. So 1, 2, 3, 4, 5, 6, 10, 11, 12, 13, 14, 15. Okay. It's good. Good. Here we go. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. It's good. It's good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. It's good. Good. We're done. Let's see what's next. Alright, so we're actually gonna perform the skill test for infant now. So just kinda like what we did, but we're gonna be your second rescuer. So then, so we're not gonna worry about the AED for infants.
Okay.
We're just gonna managing the good compressions and airway. And so when you start compressions, I'll be doing the airway.
Okay.
And then we'll switch. So you'll be doing compressions, I'll be doing the airway, right? When I'm finished with the airway, I'm gonna come over here with the compressions, and you're gonna take over the airway. Okay. So you're gonna be doing 15 to 2, right? After my 2, I'm gonna jump over compressions, and then you get
Okay.
there. Okay. Oh no. Okay, so alright, you're gonna start it off with the scene safety and everything, just like you would in your scenario, okay?
Right.
So I'll read you off the scenario, and then you're all set. So you're working in a hospital when a woman runs through the door carrying an infant. She shouts, "Help me, my baby's not breathing." You have gloves and a pocket mask, and you send your coworker to activate the emergency response system to get their emergency equipment. So you guys make sure it's in safety and everything like that.
Okay.
Good.
So, right. Hey, are you okay? You okay? Here we go. 1, 2, 3, 4, 5, 6. Okay, that needs to go.
We're good.
Yeah, alright, go get the stuff. And let's see, so 7, 8, 9, 10, 11, 12, 13, 14, 15. Bring it back.
Yeah. Good. 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 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good. Good. Okay. Now, so that's it for that. Do you have any questions?
Nope.
Done?
There are some differences when you're using an AED for infants and children younger than 8 years old. Some AEDs can deliver either an adult shock dose or a child dose for children younger than 8 years old. A pediatric capable AED will have features that allow a child-appropriate shock, but the available features depend on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children younger than 8 years of age. If it does, use them. If not, use the adult pads, but make sure that they do not touch or overlap. But never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and likely won't be successful. It's better to provide high-quality CPR than attempt to shock an adult with child pads. Some AED pads recommend placing one pad on the chest and one pad on the back for infants and children. Follow the pictures on the pad packages for proper placement.
If an infant needs defibrillation, a manual defibrillator is preferred. But as we mentioned before, this device is quite different from an AED, and it requires special training that is not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
And we're almost done here.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must act. For someone who is standing, you'll perform an abdominal thrust.
To perform an abdominal thrust, stand or kneel behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrusts until the object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist because the person is pregnant or overweight, or simply can't stand, wrap your arms around their chest and give chest thrusts instead of abdominal thrusts.
If you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
Perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because this may cause the object to become lodged farther back in the airway.
Choking is also a fairly common emergency in infants. The steps to relieve choking in an infant are quite different from those for older children and adults. If you find an infant who is choking but is still responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with with the head slightly lower than the chest. Support the head and jaw with your hand. Avoid compressing the soft tissue of the infant's throat.
Then, rest your forearm on your thigh to provide support. With the heel of your other hand, deliver up to 5 forceful back slaps between the infant's shoulder blades. Deliver each slap with sufficient force to attempt to dislodge the foreign body. Then, place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the infant over while carefully supporting the head and neck.
Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts in the same location where you would perform compressions, just below the nipple line, over the lower half of the breastbone. Do this at the rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or until the infant becomes unresponsive.
So where's my infant? My infant's right here. Alright, history, right? Go with the baby. You can also be doing this sitting down. But you're in full control of thing. Transfer over. So yeah, you want to start off with the back slaps. That's good. Good job. Good job. Alright, how do you feel about that?
Part of my life.
Now it came back, right? That's good. So I think we're done here?
Yeah. Having a belly of my own.
Oh, yeah.
Makes it. That's the part I know.
Oh, yeah. Move on. Good job.
Now that you're in position, let's begin. Follow along with the video as you practice. Here we go.
Yeah,
In
go ahead.
3, 2, 1.
More practice.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Good job.
This baby seems
Yeah, no,
so
right?
in distress right now. Like, why are you beating me? Oh.
As with an adult, if a choking infant becomes unresponsive, shout for help and have someone activate the emergency response system. Then, lay the infant face up on a hard, flat surface. You'll perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the object.
To give breaths for an infant, the mouth-to-mouth and nose technique is preferred. For this technique, you will first open the infant's airway with a head tilt chin lift. Then, place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you cannot cover the infant's mouth and nose with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
If you can see the object, carefully try to remove it. Never perform a blind finger sweep. You should only try to remove an object if you can see it. If you're alone, after about just 2 minutes or 5 cycles of CPR, activate the emergency response system. We'll pause here while you get into position to practice with the infant mannequins.
Alright, we are done. Well, we gotta finish this one.
Yeah.
Slide. That's a conclusion.
We covered a lot today. You learned the proper BLS rescue techniques of CPR and the use of an AED for all age groups, the importance of effective teamwork, as well as how to perform in a 1 rescuer or 2 rescuer scenario. You've also learned rescue breathing and what to do for someone who's choking.
Thank you very much for your time and attention today, and especially for your commitment to learning these critical life-saving techniques. We appreciate and honor the important work you all do as healthcare professionals.
You did a great job today.
Thank you.
So here's the BLS exam C. Questions in here. So it is an open book. Feel free to use your book for the test. No, it's fine. Awesome. So you got 100%. Awesome. Well, again, I'm gonna email your card out, so you're good to go. If you have any questions, that book is yours.
Awesome.
That manual, yep.
Let's get that.
Also, this runaway valve is yours.
Oh,
Yeah.
you did that.
Thank you for coming. You have any questions for today?
Very good.
Awesome.
Thank you. Learned a lot.
Thank you. I'll walk you out and you're all set, okay?
Thank you so much. Have a good day.
You too. Alright. So going from scene safety, right? Is it scene? Is it scene safety? Yes. Yes, it is safe. I'm approaching. Hey, hey! You okay? You okay? No response. I'm gonna go call 911, grab an AED. Go grab an AED and call 911. So I'm gonna check for a pulse. Listen for lungs out for more than 10 seconds. Scanning his chest, looking for a chest rise and fall. Alright, no pulse. No breathing. Initiate CPR. 7, 10, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Around. One breath, 2 breaths. Alright. Seconds. Here we go. 3, 4, 5, 6, 7, 8, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Someone's skull came, general purchase. Look at the AED. Turn it on.
Patient. If the patient is a child, press the child button. Press
Hold.
pads firmly on skin. Apply pads as shown in the pictures. Press pads firmly on skin. Do not touch the patient.
Analyzing
heart
rhythm.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button.
Okay, I'm clear, you're all clear, we're all clear.
Now,
Shocking. Boom.
shock.
Gonna resume compressions.
Begin CPR.
3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 26, 27, 28, 29, 30.
With 2 breaths.
Gonna do breaths. 1 breath. 2 breaths. Resume compression. 1, 2, 3, 4, 5, 6, 7,
20.
17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 30. And he came back alive. Cool. Done with adult. And this mess up later. Here I have my infant. Alright. Seeing safety, seeing safe. Mother hands me the baby. Put it on a solid surface. And then I'm taking the baby. Hey, hey. Hey, hey, are you awake? Are you awake? No response. Hey, you, go grab a BVM. Also call 911, go grab an AED. And then I'm going to check for a pulse, for breathing, scanning the chest for any signs of chest movement, breaker pulse, no breaker pulse. Nothing. Okay, so initiate CPR. Here we go. 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Narrowing. One breath, 2 breaths. Alright. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Two breaths. Okay. Let's just say now that respirator comes. All right, I'm gonna do 15 2. So we got turn 1, 2, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. Ready? Here we. One breath. 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. One breath, 2 breaths. All right. Coming back. Yay, we saved the day. Turn this off. All right. Scenario. Let me take my test now. So I got exam C. So number 1 is C. Number 2 is D. Number 3 is A. Number 4 is D. Number 5, B. Number 6, C. Number 7, B. Number 8 is C. 9, D. 10 is B. 11 is C. 12 is A. 13 is C. 14 is B. 15 is A. 16 is D. 17 is C. Oh, got them all. 15A. Oh no, 15 is correct. Sorry. 16 is D, so that's correct. 17 C. 18 is A. 19 is A. 20 C. 21 is B. 22 is D. 23 is A. 24 is D. And 25 is A. That's good. 100%. It's kind of my cheat sheet here. So, must connect an actual class. Yes. Mature mobile using computer. Instructor must say their names. I did. Entire class must be recorded. Yes. At the very beginning or end of class, perform adult and infant test. I did. Instructor must take a written exam for discipline. Passing score of 84, which I did, got 100. You must show a copy of your current instructor and student manual. I showed you, but just in case, I got to do it again. Kind of see this mess that I've been. So again, this is my instructor manual right here. And then again, BLS for students. I think I'm all set. Again, my name is Christopher Ventana. Reach out to you guys soon.